Good morning, respected faculty and everyone present here. I'm presenting my topic, the correlating the blink rate and screen time in computer vision syndrome patients in our tertiary care hospital. Computer vision syndrome is defined as complex eye discomfort and vision problems associated with prolonged exposure to digital screens. This definition is according to the American Academy of Optometrists. This has undoubtedly become the most common occupational hazard of the 21st century. The symptoms and complaints comprises of eye strain, giddiness, redness, watering, blurred vision, headache, and asthenopia. A review by Blem et al. Suggested that dry eye during screen usage could be caused by either due to decreased blink rate or increased corneal exposure produced by primary gaze position of the screen. Other contributing factors leading to dry eye in computer vision syndrome include poor environmental conditions caused by poor air conditioning or poor humidification of the room. Blink rate decreases as font size and contrast are reduced or if the cognitive demand of the task increases. An additional factor to consider is the completeness of the blink rates, that is whether the upper lid completely covers the exposed cornea during blinking process or not, as incomplete blinks have been found to be associated with inferior corneal epithelium damage and inferior pre-blink tear breakup. No, the normal blink rates, as we know, are 12 to 15 times per minute. Working on distal screen can reduce the blink rates to up to 5 to 7 times per minute because of the continuous staring and high cognitive demand needed while working on distal screens. To determine whether it is the computer screen viewing that produces the change in blink rate, the present study compared the blink patterns when reading either from a desktop computer monitor or a hard copy printed text under equivalent viewing conditions. The aim of the study was to evaluate the spontaneous eye blink rate in a patient of computer vision syndrome and to correlate the blink rate patterns with their screen time and their ocular symptoms. We included patients of more than 10 years and up to 60 years whose screen time was approx greater than 2 hours per day. We excluded the patient of keratoconus, amblyopia, corneal scarring, facial palsy, lid disorders, meibomian gland disorders, who had any previous use of any topical medications other than tear supplements, who had any use of systemic medications like diuretics, beta blockers, OCPs, as these cause dry eye, any previous history of ocular trauma, chemical injuries, refractive surgery, and contact lens users, any previously diagnosed patient of dry eye, Steven Johnson, ocular cicatricial pemphigoid trachoma, and Rayleigh syndrome patients. This was a cross-sectional study carried out at the Regional Institute of Ophthalmology. It was of 50 patients were selected, 25 males and 25 females, aged between 18 to 60, randomly selected with screen time greater than 2 hours per day. Firstly, these patients were asked to perform a continuous 20-minute cognitive demanding reading tasks from a desktop computer screen. Post 10 minutes break, they were asked to read the same material from a printed hard copy page at a viewing distance of 50 centimeters. Identical text was used in 2 sessions, which were matched for size and contrast. Target viewing angle and luminance were similar for the 2 conditions. Their blink rate and blink rate patterns were video recorded during the task, but it was not disclosed to the patients to calculate the SCBR percentage of complete blinks and incomplete blinks. After they are done with their task, subjects were asked to complete a questionnaire regarding the ocular symptoms experienced during the trial. The socio-demographic variables like age and gender, the type of electronic devices used, SCBR per minute, percentage of complete and incomplete blinks, the time spent on them per day on an average were taken as exposure variables, and ocular symptom experience were taken as the outcome variables. A descriptive analysis of all the explanatory and outcome parameters was done, and it was recorded. SPSS software were used for statistical analysis. In our results, we found that in terms of time spent on the digital devices per day, 12% of the patients spent approx less than 2 hours per day, 53% of the patients used screen for approximately 3 to 6 hours per day, and 35% used it for greater than 6 hours per day. This was comparison which showed that as the screen time increases, the blink rate comparatively would reduce when compared to the screen mode and the hard copy mode. And this shows that as the screen time increases, the patient has comparatively more ocular symptom experienced. So this study confirms that the decreased the blink rate and increased percentage of incomplete blink are responsible for the ocular symptoms. Also confirms that patient who used digital screen greater than 6 hours per day had comparatively decreased blinking rate as compared to the ones who used screen for less than 6 hours per day. And this proves that smaller digital devices such as mobile phones, especially held at distance of 20 to 30 centimeter from the eyes, are proving to be more responsible for causing the digital eye screen. And it's advised to use special tints and coatings for screen to avoid the digital eye screen. Thank you.
Good study, of course, is a very relevant study due to our today's era, today's practice. So, to avoid computer vision syndrome, what will be your take-home message to your patient?
So first take home message is to avoid usage as far as it is in our hands. If it's necessary, then it's not in our, it's mandatory we should use, but if it's avoidable, then we should avoid like viewing screen as much as possible. The basic precautionary method. Next is for following 20-20-20 minute rule, that when we use screen for approx 20 minutes, we should take a 20-second break and we should view something at a 20 feet distance. We should view the object so that the muscle relaxes. The main asthenopia symptom which is responsible for the computer vision syndrome, that can be cured by the 20-20-20 minute rule. And the screen coatings and tints and the blue filter glasses, although they have studies have been going on, but they are more like of placebo. What I felt that the patients say that they are feeling relaxed after using this blue filter screen, but they are more kind of placebo according to the American Academy of the studies done according to them. But they have proved, at least as a placebo, they have proved to be effective to follow the blue filter glasses. Next, the viewing angle and the distance at which we use the digital devices. This is very important. The environmental, like if we are using very airy places where the wind velocity is very high, so the evaporation rate of tears will be very high. So that can cause to more eye strain, and we should avoid using screens in the night time. The room should be properly lit. So these factors can like help reducing the symptoms for the computer vision syndrome.
Yes. Okay, fine. I think that we can now 5 minutes more, but if you have any question to the any, then we can discuss. We can utilize 5 minutes. Otherwise, we can conclude it now. Madam, if you want to say something, we can. Okay. Yeah. You say.
Other speakers are not there, I think.
Yes. Yes. Okay. Okay. Please. Please.
No.
Yes, sir, we can hear. It's
Yes.
on.
Yes.
Good morning. One comment and one question allowed.
Yes. Yes. Please.
Before any SAC operations, I would like to suggest one thing, that at least we should take ENT opinion first. This is my comment. And one question is that regarding that our the doctor, that is smart probe was there. What was that smart probe? But the paper presenter is not here.
Yeah, exactly. That a smart poop is some one company developed. It is with that um, marking, with him marking. This is actually they claim it as a smart probe. The same type of probe, that is with some marking in mm. So you can assess how many millimeters is already inside. So at that what level there is a block. Basically, that smart probe was developed to rule out any canalicular obstruction initial phase. So suppose obstruction at 9 a.m. or 8 a.m. 6 mm. Accordingly, that with the smart probe you can assess. In the normal probe, if you want to do a diagnostic probing, my technique is that, so I just hold with at the end. Once there is soft stop or whatever, I just with a one plain good forceps, then I measure with a simple plastic ruler or any other ruler.
Okay.
Maybe a wooden, maybe plastic, whatever material available, good quality. That's enough. But with the smart probe, if you don't have done any forcep in your hand or scale, so you can assess it is a 9 mm like that. And for probing also, it can guide you. That's one.
Right.
Regarding your first one, that ENT opinion, some of our ophthalmic surgeons also doing lots of endoscopic this year.
Yes,
So that's the reason. That's myself is I will be feel I will be more confident if I examine myself my cases
correct.
endoscope. Your endoscope is there. There's a no need. As per Ayushman Bharat is concerned, they want one X-ray
Oh,
for that one X-ray. So X-ray also one of the indirect evidence. So you can order for X-ray and you can go for a endoscopic evaluation if you have. But unfortunately, most of our ENT surgeons they do not have that endoscope. If you are referring the patient, if you have a endoscope, but you don't have that, your ENT colleague don't have any endoscope, then it will not be a justice to sending him to the patient for evaluation. Rather, for safer side, if you want to go for a safety point of view, then you
yes,
can go for a X-ray PNS
yes,
which can exclude DNS and maxillary synovitis or whatever any other pathology. So, from a legal point of view, you are almost okay, and then you can go for endoscopic evaluation.
yes. Thank
That's
you, sir.
I always prefer my cases. I will evaluate myself.
Thank you, sir. And
Yes.
one more question regarding this computer vision syndrome, whether this ARC, anti-reflective coating, these blue ray lenses, are they really effective?
Uh, Companies are claiming,
Yeah,
but on the reality, there is no such proof. But companies are, that is a business market. Basically, is a marketing trend. They are claiming so many things, but there, on practical, there is nothing. So that's why I'm asking very valid questions. So in computer vision syndrome, blink as much as possible. Then whatever, sir, next is that is suppose you are in a AC room. Once you can go out, then you can just acclimatize your climate with your outside. Those are the very important tips. So education is one of the big role on that patient's education.